Hi, everyone. Welcome to this session on East Africa. My name is Cher-Wen DeWitt, and I work as Director of Partnerships at Segal Family Foundation. Today, I'm just so happy to be having a conversation with Khadija Omar Rama, who is the founder of Pepo Tumaini Jangwani. They have been a partner of ours since 2015, although Khadija founded the organization in 1994. It works primarily to provide education and healthcare to women and children who are affected by HIV, and Pepo runs a health clinic, an early childhood center, and a primary school. So we were really excited to call upon Khadija today for her insights, because not only does her work span across multiple sectors, but we really feel there are deep connections in her experience between currently the COVID-19 situation and the HIV/AIDS pandemic, and really great lessons and wisdom to be shared from that experience. So just really excited to be chatting with you about this today. Khadija, is there anything about Pepo that I might have left out that you think would be helpful for people to know about your work before we get started?
I think you're good. The way you've introduced it, it's okay.
Thanks. So today, I just wanted us to chat a little bit about the impacts of COVID-19 and really how you and your team are experiencing it in Isiolo, and what lessons you think there are for East Africa as a region in general. But from your perspective, I was wondering if we could start by talking about what you have been seeing as the most significant impacts of COVID-19 in the region and in your community.
Well, thank you very much for having this opportunity to be able to discuss and explain what is happening in our region. Actually, being in the northeastern part of Kenya, we are pastoralists, and COVID-19 has got a major impact in our community, but so different from the rest of the world. We have not been able to experience like so many people occupying beds in hospitals or so many deaths. But what we have experienced is a certain kind of insecurity in the social setup, because COVID-19, when it came, not so many people in my region understood what it was. And there wasn't enough time even for the government to disseminate enough information to our people. So in fact, it came like a big scare. And up to date, what we're experiencing is a lot of social gaps, because so many social systems have been destabilized in our area, and especially the lockdowns. Our people never understood what the lockdown meant, but they only thought it was like people were being put in concentration camps. So movement being stopped for the pastoral community was one of the major setbacks in our life. Our livelihood is around moving around to seek for our basic needs, but it was not possible. So the poverty gaps, where we had already had restrained poverty measures in our society, were even made bigger than before. And also to explain why, sometimes we would understand that poverty or suffering, human suffering, was from maybe drought or clashes, but this time it was very different. It was just instruction from above, which was not properly explained. And then lack of children going to school was very discouraging, especially to our main organization, because we've been campaigning year in and out to get children to schools. And here is the government who told people you can't go to school. So it brought a lot of confusion and loss of confidence from most of our community members. And we had really to go up and down to try and explain. The other thing is loss of jobs. For the few people who had migrated to the urban areas and were sending back support to our back home, it was impossible because most of them lost their jobs. So actually the impact, we can say, is mainly the economical impact that actually affected our area, and also the social disintegration and lack of confidence with what development means.
Yeah. Thank you for sharing that, Khadija. And I think it certainly resonates in terms of what we're hearing from other partners across the region as well, which is that for COVID-19 to be approached only as a health crisis is not enough because its effects are so multifaceted in terms of what you're highlighting around economic insecurity, educational interruptions, and instability. And certainly what you said about it highlighting social gaps that already existed and making them even wider, especially in communities like yours that have already been fairly marginalized. I'm wondering if you see any similarities or if there are any lessons that you are drawing from your experience with the HIV/AIDS pandemic in terms of how you and Pepo Tumaini are approaching the COVID-19 pandemic now.
Actually, COVID-19 has come, let me just say, in my experience and the experience of my people, is that it has created more of our healthcare possibilities. For example, our healthcare system is actually very highly unequal because mainly there is a lot of difference between the private and public sector in healthcare system. And COVID-19 came at the back of a very strained healthcare access to our people, especially the pastoralists. And the difference between healthcare system in the urban and rural area is the margin is too big. So when we talk about accessing, we look at COVID-19 coming to restrain and restrain all the possible measures that we had put in place to fight HIV, tuberculosis, because what has happened is that these gaps have even become bigger. And for example, in our countries at some point, because of the rampant and extreme, they were trying to put so much effort on COVID-19, there was a point in time that we didn't have antiretrovirus. And that one brought a big blow to our organization. Because for years, we've been making people access ARVs, telling them that it's their lifeline and it is not good to stop them. And here the government was not able to provide ARVs. So adherence was a major issue. And so many people fell back into being very sick, and nobody was looking at that. The attention of the healthcare service in the country was only looking at COVID-19. So many other diseases came up, and in our organization, it was very difficult now because we had to do almost everything like as if it was the initial stage of trying to enlighten and sensitize people about healthcare services, HIV, tuberculosis, malaria, and we felt that COVID-19 came to restrain our strength on trying to enable our communities to access healthcare services. And it is also very different when they look at us when we tell them, okay, COVID is here, we still have to take care of our HIV, our home-based care services was strained. And when they asked us about what is this that we hear about vaccines, it's not, none of our people, nobody has ever been even tested, leave alone vaccine. And it is far beyond our reach to think that in the near future, our people will be able to be tested. So it reached a point whereby we kind of feel defeated. But what we rely on as people at Tumaini is the resilience of our people. Whenever any crisis comes, we say we still have to put our heads on top of our necks and make sure that we move with the world. The irrelevance of the gaps that have been created by COVID-19 is actually leaving so many of the poor communities behind in a world that is racing. Whereas as pastoral communities, we depend on our resilience and say we still have to be in the race, whatever it means. We are very grateful to our major partners who keep us alive and give us the fuel to keep on running towards a direction that we hope will come. And that is why Pepo Tumaini is the wind of hope in the desert. And our people are still holding on to that, and the support and the guidance and the technical support we are given by our partners and the world at large as our well-wishes.
Thank you for that, Khadija. I think it's quite sobering, the implications of the really big gap between rural and urban healthcare and the rural and urban response that you're describing, where not only are basic services like testing not available or vaccines are not readily available, but it's also interrupting the provision of service around health conditions like HIV and TB that really require continuity of care to ensure good outcomes, to prevent drug resistance in people. And the note that you ended on around people really drawing upon the social fabric for support of each other is one that I think is really important. And I'm wondering what you think what role funders can play in not only helping organizations to close that gap or to coordinate with each other to, kind of increase the attention or services that make it to rural communities, but also what kind of support can funders give to really back the type of social support and resilience that you're describing?
Well, thank you very much. Funders have a vital role to play now, because actually it is because of the support of funders and others that there is still survival and there is still a face of dignity on the human sufferings today. This is because as funders, we are looking at, we would hope that they would look at the holistic approach, because COVID is just an addition of other social problems that people face. But when you just concentrate on COVID, then I'm sure we are not going to win this battle. But if we look at the holistic approach on healthcare, socio-economic factors, and also the political, because the governments are using COVID as an administrative tool, sometimes even to oppress. If you look at the lockdowns, those ones were used in a very bad way, because most communities suffered under the police, because for them to understand that they have to be locked down and the curfews. I'm sorry, that's the call for prayer that's interfering. So when they have to call for lockdowns and beating up people, knowing very well that our people have to earn from hand to mouth, that one was very discouraging. And it never brought the message down to the people in a proper way. So they look at it as a way of manipulation, and also a way they took control in a very dictatorship way. But if the funders look at local initiatives or grassroots initiatives like our own, to look at the main strength of the same initiative, to build up a resilience towards hoping and moving forward, even with COVID-19, the human person has got a coping mechanism which, supported appropriately, can actually see them through any type of crisis that we have ever seen. As pastoral communities, we've lived in a world, in our life, with crisis. There is drought, there is war, there is starvation. And all through, because of the togetherness and the willpower to move on, I am sure humanity can move on through the pandemic of COVID-19 and be successful if we look at all the root causes of what makes up a person, what is about people and life and the harmony of that. If funders can support the holistic approach towards healthcare, towards socioeconomics, towards good livelihoods, I am sure we are going to make it.
Thank you, Khadija. I'm really glad that you said that, because I think it's a really important point to be made to a lot of funder circles, where I think very often people want to focus on very specific types of projects or very specific types of interventions, especially within the pandemic. And what you're describing is so important in terms of really providing holistic support to communities and also getting resources to organizations that have deep trust in the community, especially at a time when there is so much misinformation, when people have really lost faith in the guidance of governments or of larger entities. I know that at Segal Family Foundation, we really believe that place-based and community organizations have an incredible role to play in the efficacy of any kind of response, not just to the pandemic, but its effects, especially because of just the strong amount of investment that you have in your communities and the real level of communication and earned trust that you have there. Are you, in terms of, I know that within our team, we have been talking about what does it look like to move from an emergency response attitude to COVID-19 to thinking about how to support communities long-term in a changed world. And I'm wondering if that is something that you are thinking about at Pepo Tumaini. If what do you think it means for your organization to kind of deal with this in the longer term timeline, but what kind of support from funders would also make that possible?
Actually, right now, I want to believe that in different parts of the world, people have different experiences about the impact of COVID. In our world, when we look at it, is that the social system has been disintegrated. And that is where we have to start to provide the harmony between people and life. At the end of the day, it's about people and life. And without harmony, then we are not going to be able to do anything. So Pepo Tumaini counts on the awareness and sensitization of our communities to understand what is relevantly happening now and to prepare them and to enable them to learn, to access what is possible, to be able to cope every other day until we can step out into another day. And in that way, funders can support the holistic approaches that organizations which are already in the ground, in contact with their community confidences, to be able to enable humanity to move on with harmony, so that they can be able to face whatever crisis comes across. So we are really deepening our efforts and committed with our communities to make them realize that it needs time and it also needs effort to be able to understand what is happening, and also so much more effort and confidence, commitment to be able to raise up with the world and try to fill up the gap. How do we do this? Is awareness, is capacity building, and it is also enabling whoever needs health to be able to access health, and also children to access education. So in as much as there is COVID and all these other crises, they are just like any other crisis that we have faced as a pastoral community. And we still have to make sure that we move on, hoping for the best. And in that way, funders should be with us to enable our people to move through this crisis. And it is only within the holistic scope that we are going to be able to support. We look at the future and we see us there. We don't care about the gap because we are still on the race and we are going to race with our people. And as far as the people have the same common front, we are going to be there on the global platform someday.
Absolutely. Thank you for that, Khadija. I think it leaves people with some really strong messages and some really important lessons around what it means to really trust organizations and activists within communities to communicate what the priorities of that community are, to really kind of continue to support people to respond with adaptation to not just the COVID-19 crisis, but other ongoing kind of gaps and vulnerabilities that require people to kind of continue learning and continue adapting their ways of not just surviving, but living whole lives. I think that we are coming near to the end of our time together. I'm wondering if you have any last thoughts that you would like to leave people with that you think could prompt important discussion.
Well, thank you very much. The first thing I would like to say is I'm very grateful for Segal to make it possible for the pastoral community's voice to be heard. We were wondering in what way can we be able to reach the world platform to explain what COVID is to us. because COVID is like a piece of literature to the world today. Every part of the world is experiencing it differently. When I look at the pastoralic community, and then I look at the neighboring communities near us, especially the non-pastoralic, I can see the difference in how people are perceiving it. It is very important, and I'm so grateful again for Segal to give us this platform. And everybody who's listening to us, please look at what we are saying, because we are so happy to be able, even to be able to say things like this and to reach other ears which can explain us in the rest of the world. We are committed to make sure that there is harmony between life and people. And with the support of the well-wishers and good friends like the ones on this platform today, we are going to be able to be heard, to be understood, and also to be enabled to be with self and dignity.
Thank you so much, Khadija. I know that your work is so important, not just to the people in Isiolo, but to all pastoralist people who are working in the region. And I think what you're leaving us with is absolutely the right thing for people to consider, which is what it looks like for people to be self-determining in the face of crisis. So I'm so grateful for the lessons and the insights that you've shared. And yeah, and with that, I think we can close our conversation. I really appreciate you taking the time.
Thank you very much, and thank you to everybody who's been there.